Good afternoon, everybody. So, welcome to Friday's webinar. So, today's topic is going to be on the busy shift blueprint, how to prioritize tasks when everyone needs you at once at your workstation. So before beginning up the session, I'll take you through the quick introduction about us. We've been established since the year 2018, and we have been committed to providing the comprehensive training programs designed to enhance the capabilities of the healthcare professionals. So far, like 10,000 plus healthcare professionals have linked with us, and then no getting benefit like you all the 10,000, like all you together we are talking about, and 75 plus hospitals are in network with us, and 50 plus course topics have been launched. And it's not an end. So to be a part of this, to exceed more healthcare professional getting adding into our platform, so become a part of a growing community, and also enhance your skills, and then build the confidence by the structured programs and transforming your patient care into amazing things. So what is this about this skills for med learning pyramid? This is our logo. So this has 4 stages. One is like stage 1, which speaks about the service excellence skills. That is actually when an individual join into the hospital, certain quality is expected from the healthcare team. That is, for example, like the professionalism, communication, infection prevention basics, so startup in a healthcare setting. So that is about the stage 1. So stage 2 is about the core patient care skills. It's about focusing on the bedside procedural skills, when it comes to the patient safety and the patient experience. It's not about a particular individual is competent and one particular, procedure. It is also speaking about being a clinical expert who is competent in all kind of procedures when it comes to the patient aspect. And third thing, when you have transformed yourself as a clinical expert, it is not again an end. You have to choose your specialization, like which is going to be, for example, to be a specialized person in that particular field. For example, like labor room upskilling program, emergency room upskilling program, and also ICN, infection control nurse, and the clinical instructor who aspire to become a trainer in their own unit. And that's not an end. After becoming clinical expert and then transforming into a specialized nurse, and then you yourself can look into the leadership role. So that is again, you have two paths to upgrade yourself. One is the vertical path, which is like normally you start up a career as a staff nurse, senior staff nurse in charge, supervisor, ANS, DNS, and the CNO. So, or else you can even take diversion onto the lateral path. You yourself looking into the administration role, where you will have a goal which you can see yourself as a CEO of the hospital. So that is about the stage 4. So this is all about all 4 stages where the skills for med is working on this learning pyramid. And where I was talking about the specialization course in the stage 3, this is an announcement here. Infection control nurse course program, which is given by the skills for med, collaborated with 𝐎𝐫𝐬𝐞. This is a self-paced learning, so you can learn in your convenient timing, and the special offer is running out here. You can see the cost price, which is like 17,700 inclusive of GST. The course highlights is too comprehensive, where we have seen a lot more nurses who have taken this course have themselves had a transition as a transition into the career from the bedside as an infection control nurse. So to know more details about our course and details, you can contact the number on the display. She is Miss Jayanti, our admin manager, and also you can visit our website, which is www.skillsformed.com. So coming to this today's session, so it will be it will be like an interactive session. So I'll be there. I am Stella Townsend. I am the nurse training manager in Skills for Med, and we'll be sharing this with Dr. Parivalvan Rajvelu. He is a consultant surgeon from Sundaram Medical Foundation, and he is a visionary founder of Skills for Med. He is a quality-oriented person, and he has a great vision towards the healthcare professionals to move them from the routine into the leadership level. So that is what he is, and he has a key role aspects in 𝐎𝐫𝐬𝐞, and he have done a lot of international journals journal oriented works. And no, welcome you, sir. We are so glad to have you here. So before starting up the session, no, as usual, we have a poll here. As last time Dr. Pari was saying, this is not to check your knowledge. It's about like what do you actually think about, about this busy shift blueprint. So I'm going to launch a poll where you'll have 5 set of questions. I have launched it. So just feel free, everybody dive into this poll and then keep answering for this question. There are 5 interesting questions which gives us a lead to take up this session. Thank you so much for your immediate response. Thank you so much. Start filling it up. This poll will be there for another 3 more minutes. So we have 2 more minutes left. We have 1 more minute left. Thank you for all your active participation. So you have 1 more minute left. You can keep answering to this poll. Yeah, you have 15 seconds left. Yes, I'm going to end this poll. Thank you so much. And yes, I welcome Dr. Pari to take up this poll discussion to make it much more interesting.
Yeah, I think, thank you, Stella. Good afternoon,
Yes.
everyone. So let's have a look at the results of this poll. I think more than 50% have answered this.
Yes.
Priority panic assessment. How do you typically feel when multiple urgent tasks hit you simultaneously? I think most want to be very heroic and they say we feel like Tom Cruise in Mission Impossible. I got this under control. So that's good.
Yes.
No more than 50% have things under control. And the next major chunk is Home Alone. I forgot something important. So that's also quite eliminating. There's not, and the least one is Hulk. I'm angry about interruptions. And
Yes.
then Elsa and Frozen telling the pressure never bothered me. So that's about 9%. I think it's really shows that all of us are, really having some problems rather with how to manage a busy shift. So when you go to the second question, it is what is the biggest challenge while prioritizing tasks? And again, no, majority have told that determining what is truly urgent versus what feels urgent. I think now very insightful, because many times we will again explain this in the webinar. It may feel urgent, but actually not a genuine urgent task, and we get carried away. So that seems to be, the major issue many people are having some problems with. And then managing interruptions from colleagues and emergencies is another 25%. Keeping track of multiple patient needs simultaneously is another equal number, 21%. And finding enough time to documentation is another 10%. So third is about experience level. How much confident are you in prioritizing your tasks? So this again, we have a lot of experts here. So I think Stella, you have to be careful, right? So we have
Okay.
81% who are either expert or intermediate, and only
Okay.
a minority are beginner and survival. So we have to be careful what we are saying here.
Yes.
Right? And the fourth is tool usage assessment. Which tools do you currently use for task management? Again, majority 63% have either a written list or a checklist. So this is again what we see, on a day-to-day basis in our hospital. 20% are giving only mental notes and memory. I mean, hats off to you. I can't, if when I go to the third task, I forget the first task. No, that's how old I am now. And 20% use digital apps or hospital system. And the structured frameworks, quite a minority are using. And
Yes.
fifth, the last question is about burnout. How have you felt? Have you felt ever completely overwhelmed by competing priorities? Again, it looks like quite a common occurrence. Almost 40% are facing it daily. Another 20% are facing it on a weekly, at least once a week, they would say, but manageable. And 31% again are the ninjas here. They feel it occasionally, especially during busy periods. And here are the top 13 of the cream de la cream, who say rarely I'm fully in control of my workload. So again, hats off to you guys. So that's a very, very insightful webinar. Thank you so much for putting in such interesting questions. Thank you.
Yes. Thank you so much, sir. And yes, I've stopped shared. So we'll go ahead. Yes. So the 7:30 a.m. reality check. So what is actually going to happen? So just a startup hook statements like you walk into your shift and no three patients need immediate action. It's like everybody together, no having high risk priorities. Like the second thing is like emergency call from ICU and the family members are demanding for the updates. That is also crucial no things which you have to look into it. And no, I'm asking everybody to put forth yourself into this place. And then documentation overdue, medication rounds is starting. I know it's all sounds familiar, but you should feel like you're not alone now in this moment. So I'm sorry, all the participants. I have another interactive poll for you all to make it much more interesting. What causes more stress? Because now you have seen no a list of things what I was telling, like three patients at a time asking for a care, ICU, one of the patients ended up demanding for the update about the patient. So many things I've read out, like four more things. Like, so what causes most stress for you? Like I have given the options. The number of tasks in your shift really bothers you, or deciding which task to do first, or managing interruptions while you're doing the task, and then which task to delay or delegate. These are the four options. So I ask all the participants to drop down your most stressing factor out of this four into the chat box. Okay, third one, managing interruptions while I'm doing my task. Managing interruptions. I think so far managing interruptions. Okay, second one, deciding which task to be done first. Okay, third. Okay, some are saying fourth one, which task delay or delegate. Managing interruptions, number of tasks in your shift. Okay, interruptions. I think most of them are like about interruptions, Dr. Pari.
Yeah, I think
Yeah.
we are covering this in the
Yes.
major part of
Yes.
our
Yes.
webinar. Yeah.
Yeah. Yeah. A pain point for everybody. Deciding which task to do first, third one. Yes. Yes. Thank you so much. Thank you so much, for all your active participation, taking your time to, drop down all your suggestions in the chat box. Thank you. So we'll proceed with the,
I think the majority is interruptions actually.
interruptions. Yes, yes, majority. So today's agenda is going to be understanding the signs of managing the priorities, no, and then Eisenhower framework for instant decision making, and then 2 minute rule, and managing interruptions. What you all were, no, in the chat box maximum were telling like how to manage the interruption. So we are going to deal with that even without how to manage interruptions without losing focus. And the last thing will be about the smart delegation tactics. So this is going to be a really interesting session today. Like, this is our agenda for today's webinar. So what is, if like a person like having a poor time management in the healthcare, what are all the hidden impacts are occurring? Like, you can see the no percentage, or where you can say on the display, like burnout rate, being so stressful in this particular situation, when it's like when you don't have a good quality at the time management, 42 percentage of burnout rate is increasing. This is the Indian healthcare professional. This is all from a real study which have done in the healthcare system, and the percentage out of that. And when you're really stressed, and then when you're really like into the burnout situation where you cannot focus into the task, so this leads to 23 percentage of error increase, where you will not have a good task management skill, and then that leads to medical errors and all. And then when you commit to a lot of errors, and it obviously hit the patient satisfaction rate. So the satisfaction rates will get dropped, and that is like contributing for 18 percentage in the healthcare system. So that is where all your complaints are getting raised, where the patient experience have been lost in the healthcare system. And you might even have to extend yourself in your duty timing, like 45 extra minutes to complete all your overloaded works. So that is like inefficient prioritization. That is like you have to extend your shift duration. So this is all the hidden impact of poor time management.
I think 45 minutes is just the average, right?
Yes, that's the average. Yes.
Some
Yes.
may go even a few hours.
Yeah, you're right, doctor. Yes. So he is our hero of this today webinar. So you can see him on and off, like meet Mr. Arjun. So he have just started a busy shift. So this is his shift when he started, like how it was 6:45 a.m. Like he like reviews patient assignments across multiple departments. So 7:15 a.m. emergency code blue came up, okay, which is unfortunate, and staff shortage alert and equipment malfunction. Three major critical things are happening here in 7:15 a.m. So 8 a.m. already behind the schedule, feeling overwhelmed. Yes, because a lot of critical things have come up. So how can Arjun transform this chaotic start? So what happens in your brain under pressure? So no, we have seen Arjun. What is happening? Started with a mild day, and then in middle of the shift, he have come across with lot of critical things to be done, and he is already like overloaded with all of works. What happens in your brain if you're really under pressure? Like you don't know like how to manage the situation, will get stressed up. So what happens is like stress hormone reduces the decision making clarity by 40%, because usually the cortisol production is there when the stress is increased. So what it does actually, it influences our thinking process. So where we'll have a blurred decision, will not have a clarity in taking a decision what has to be done next. And then it also reduces our productivity during our shift. And multitasking decreases efficiency. When a lot of things are getting increased in your daily routine task, what happens, you will not be able to focus on all the things. We might think we are good at multitasking, but actually speaking, at the time the brain can focus efficiently on one task. So to be honest, that's the honest truth. If you do multiple tasks, there is going to be increased errors. And this is again about cognitive overload. So when the stress have come, due to that, we might think even the fight or flight response. Morning even we had a discussion where we cannot flight, so we have to stay there, and then no, we have to fight against that, and then we have to solve that. Somehow we have to resolve that issue to progress in our work. The last thing is like about structured system restore prefrontal cortex control. So if it is overloaded, we have to think some standard structured way, where Dr. Pari will be telling about that. So where it's like structured way where the brain can have a relaxation time of that overload work, and still more helping us to enable our work in an easier way. So what is that structure way, we'll be dealing in the future slides. This is all the things what happens with the brain when we are like under pressure. So yes, doctor. So now talking about the Arjun. So when a lot of tasks are coming into our way, like how to decide which task to do first. So that is the important thing for everybody to know. So can you please take us through that?
Yeah, shall I share my slides or you want to just move the slides?
I can move the slides, doctor.
Okay, fine.
Yeah.
All right, next one.
Yeah.
Okay, no, the previous one.
Sorry.
Okay, so prioritizing the tasks is what we are first going to talk about. And I think what Stella talked so long was about the science of time management and why it is important. And she very clearly pointed out that if you are not having a system or a structure to manage your time, then you are going to be under stress, and that will lead to a lot of errors, and the patient safety is compromised. So many of you would have come across this 2 by 2 table, which is known as the Eisenhower matrix. Eisenhower was one of the former presidents of the USA. He was an extraordinarily productive man. I mean, he did so many things in his life. And when somebody asked him, "How do you manage your time?" and this is what he said, "I'm using." So till since that time, now a lot of time management gurus and books have talked about the system, and this seems to work. So basically, what you have to understand in this table is we have on the vertical axis, you have the important and not important here. Okay, imagine this is a 2 by 2 table. Okay, so this is one column, this is one column. So the vertical column is important and not important, whereas the row is the urgent and not urgent. So this divides the tables into 4 quadrants. Now, the first quadrant is both urgent and important. Okay, say for example, a code blue going. So that is urgent and also important. So that is quadrant 1. So it is crisis management and emergency response from the healthcare setting point of view. So the point here is this Eisenhower matrix is usually found in business books and told by people who are running businesses. Healthcare hasn't really taken this to heart. So that's the reason we are introducing this here and adapting it to the healthcare system. So that is quadrant 1. All of us are very familiar about quadrant 1, where we drop everything and run when such an emergency happens in the hospital. Now, quadrant 2 is important and not urgent. Actually, in life or even in any busy shift, this is the most important quadrant because it is important but not urgent. So, because of that, what will happen is you will keep pushing it backwards because it's not urgent. So, you keep doing it for days, months, or even years. The most important thing you have to do will get neglected. So very, very important quadrant. In terms of healthcare, it is preventive activities, quality, activities is one example of important, not urgent, except 2 days before the NABH assessment, right? Then it goes to quadrant 1. That's when we all work for the NABH. But if we work in quadrant 2, preparing for NABH, then you won't go into the quadrant 1. So that's the idea. Okay, so this is important and not urgent. The third is not important but urgent. What do you mean by that? So, not important to you, it may be important to somebody else. So, what will happen is, depending upon your hierarchy, right? So, if I'm the boss and I have a meeting to go within 30 minutes, I will come to you and say, Stella, get the presentation ready, right? So that is not important to you, known to Stella, but because of our hierarchy, it becomes urgent. Okay, so these are unplanned interruptions and sometimes routine meetings. Several meetings. We keep meeting after meeting, committee meetings, and all those things. So you need to be very careful. If these meetings are important, you have to ask that. Many of them are not important but urgent, because once you put a time, it becomes urgent. Right? So that is the third quadrant. And the fourth quadrant is not important, not urgent. Ideally speaking, you should not be in this quadrant at all. If you want to be really productive, right? So you won't be doing tasks which are not important and not urgent. But many times we do this busy work and non-essential task. In today's day and world, the endless scrolling of either Instagram or whatever social media you're using is this not important, not urgent task. And many of us are guilty of spending. Now, if you do the digital well-being in your phone for about a month and go and look how often you use your social media apps, you'll be surprised. So it'll run into 2 hours, 4 hours per day. Okay. So this is the not important, not urgent quadrant. So this is how Eisenhower prioritized his tasks and was able to become the president of the USA and do so many other things. So how can we adapt it to the healthcare scenario? Next slide, please. Okay, so on the whole, if you look in any busy shift, yeah, you keep clicking till we see 6 items, Stella. Yeah. Okay, so there are 6 major categories of tasks you'll be doing in any shift, whatever seniority you are or junior you are. The most important task is direct patient care, right? It's here, direct patient care. And okay, so this is the direct patient care. And then a lot of time is spent in the documentation skills, documentation time. Okay, you're writing notes, you're writing reports, all those things. And as many of you pointed out, in a shift, it'll be very nice if you can do my work, but you keep on interrupting me, right? So interruptions, especially from seniors, you can't ignore it. Patients, again, you can't ignore. Codes are so important. And then there are several meetings you have to attend. It goes on and on. So there are several interruptions. And then there are communication tasks which could be planned, like handing over or informing a lab report. These are no communication tasks, or attending to the phone and things like that. Then, depending on your seniority, you may have some administrative tasks like putting the rota, indenting, and things like that. Finally, in middle of all this, you also need to keep up to date, because the knowledge is changing day by day, and you need to do some learning on your own. You need to develop your professional skills so that you move up the career ladder. So these are the broad categories of wait a minute, jobs or tasks anyone in healthcare sector will be doing in a particular shift. Next slide. So why do I, put that thing? I think, I don't know, the tick marks are not going. You probably have to 1 minute. Let me bring the eraser. Yeah. There should be something for clear all, no? I'm not familiar with that. Okay, here we go. So the most important principle, as anyone in the healthcare sector will know, the patient care tasks always take priority. No doubt about that. Nobody, even questions it. Okay. So when in doubt, we ask ourselves, will this directly impact patient safety, comfort, or clinical outcomes, either now or in the future? And if it is so, we will prioritize it. I don't think anybody has got any problems with this. But I'm starting with this because this is the foundational principle if you are working in a hospital. Okay, if you are new, just join the hospital. This is an important lesson for you to know. But anyone who's worked in the hospital even for a few weeks will understand this principle. Next slide. Okay, when that is taken care of, next slide.
Yes,
Yeah.
sir.
So
Yeah.
now let us look at the the quadrant one. Okay. So what is quadrant one in those six broad categories of tasks we pointed out? So which one will come under this? The crisis management and emergency response comes under quadrant one. So it is urgent and important. If you know you are in this quadrant to save lives and prevent harm. Okay. So decision criteria is what are the tasks that must be done now to prevent immediate harm, deterioration, or death. So any threat to life, threat to a limb, these sort of things come under this category. So that is why codes or a patient who comes with an ischemic leg or a patient who comes with sepsis to the emergency, we just take, they take priority and we treat them. So this is the quadrant one. Next slide. So quadrant two, as I said, is the most important because it is not urgent but important. So many times we will postpone it. So tasks that prevent future problems, improve long-term outcomes, or build capacity. So the question to ask is, will this make tomorrow's work more effective or prevent future emergencies? This webinar is a very typical example of quadrant two activities. So many of you, almost 200 of you, have left your tasks and come here to listen to this because it is not urgent, but it is important. You want to improve your time management skills during a busy shift, and this is a very, very important quadrant to be. So patient education or our own education, or as I told you, quality improvement activities, all those things are doing an audit. All these things are not urgent but important activities. Next slide, please. So the third quadrant, it is here a little bit of confusion creeps in, okay? Because we react, these are things which hit you all the time and you have to keep reacting. No, it is as if, you have a bowling machine which is, throwing the balls at you every few seconds and you got to, somehow either go on defense or, put it out of into the boundary, right? So these are urgent but not important, could be false alarms, could be distractions. Now, you can't generalize that all of them are false alarms and distractions. So you need to decide. So how do you decide? Asking the question, is someone else creating artificial urgency? Can this wait or be handled differently? So tasks that demand immediate attention but do not significantly impact patient outcomes or your own professional growth will come under this quadrant. So routine observations, for example, could all be bunched. So many times, you have to be efficient. So this is known as task batching. Okay. Task batching is, if you want to do a particular type of task, for example, if you do want to do, that is why, this medicine rounds and vitals rounds are, being done by nursing. So you batch all this. Similarly, you can do on an individual basis also batch tasks together to do it more efficiently. But more important is deciding whether it is really you got to do it now or can it wait. This really depends on your hierarchy, really. If you are very junior in the, in the hierarchical system, you have no choice. Quadrant three tasks you have to do. You have no other option. Now, when your senior tells to do something, you cannot say, sorry, it is not important for me, right? You can't
Yes.
say that. So it all depends on your hierarchy. But once you come to the middle grade or to the, little bit above that, supervisory role, it's a very, very important decision you have to make in quadrant three. Do you want to attend that meeting? Are you really going to make any difference to the meeting? or is it important to me? You really have to ask yourself, be selective about attending such meetings. Okay, so this is where you can actually save a lot of time, right? So that is quadrant 3. Next slide. So quadrant 4 is busy work and non-essential task. So sometimes, we call this professional procrastination, because you would actually have a reason for pushing this because it is not important and not urgent. So, you might find tasks in this quadrant also. So, for example, I check emails and check my WhatsApp. I don't have any notification on my WhatsApp. Now, my team is a bit frustrated because of that. I don't I check WhatsApp like email. No, I'm one of those dinosaurs here. So I will usually check this probably once in the morning and then once in the afternoon, where my energy levels are very low after lunch, and maybe at the end of the day. Okay, so quadrant 4 also need to be done, but you could do it at a time where the other tasks have already been done and you have some free time. So activities that consume time without meaningful impact on your patient care or professional growth. As I told you, social media and other things, and if I eliminate the how to decide which whether tasks belong in this quadrant, is I've eliminated this task entirely, would patient care or my competence suffer? If the answer is yes, don't do it. Okay. One typical example is workplace. We didn't want to say politics, so we said workplace drama. Okay. And you waste a lot of time in talking about, oh, this guy told like this, he's always like that, or the hospital is always like this, they're not doing this, doing that. You can't do anything about it. I mean, if you want to do anything about it, find another job. But many times we waste our time, in this sort of gossip and chatter, and spend time in the hospital. So this needs to be avoided. Okay, so I hope you get an idea how to prioritize tasks. Okay, the Eisenhower matrix is very, very useful. So imagine, you have important, not important, I'm sorry, urgent and not urgent in the columns, and important and not important in the horizontal side. So quadrant 1 is urgent and important. Quadrant 2 is not urgent and important, which is very, very, important for your life and your profession and for the patient. Quadrant 3 is not important to you, but it becomes urgent to you. And quadrant 4 is not important and not urgent. These are usually busy work but wasteful work. Okay, I hope this will help you in prioritizing your tasks in the next shift. Next slide. Yeah, I just also wanted to mention this 2-minute rule. So any task which would only take less than 2 minutes, you have to do it immediately. Don't postpone it. Okay. If it is just that I have to put that signature in that particular case sheet or write the date and time and sign it, it's going to take less than 2 minutes. Don't postpone it, because you will never do it. Okay. Because it's a trivial task and you won't remember it. Okay. So anything less than 2 minutes and it's important, no, do it immediately. And if it is going to take more than 2 minutes, usually it will not a single task. It will probably 2 or 3 steps to achieve that particular outcome. So it is better to have a checklist in your either pen and paper, or use your digital apps, whatever is comfortable with you. You use that and use a checklist. So very, very important, this 2-minute rule, and it makes you very efficient. So it prevents small tasks from becoming, overwhelming backlog. So if you keep on adding this, then it becomes, a lot of tasks to do at the end of the day. So from the nursing point of view, quick patient comfort, maybe just, adjusting the thing can be take only 2 minutes. You can't tell the patient, wait, I'll come back. It's better to finish that and go. Similarly, if it is just a brief family update, you're just going to tell, the doctor will be coming in, half an hour. Is delayed. Is, the theater list got extended. So if this is something which you want to quickly update, you can do these things. Don't postpone it. It definitely reduces mental load and creates momentum. So in the prioritization matrix, this also is important in terms of implementation. Next slide.
Yeah.
Okay, Stella, you can take over now. We'll see how well have I explained this. It's a test for me more than for the audience.
The success of Eisenhower explanation. So we can see now, like, no, this is all for you, my dear participants. So we have four scenarios here. So, no, I'll just tell you. Scenario A is about organizing personal supplies and rearranging the workspace. Scenario B is printer not working at the nurse's station. Scenario C is about administrative meeting about policy update. And scenario D is about equipment malfunction affecting multiple departments. So put yourself into this all this scenario. You're getting all these four tasks. So using the Eisenhower matrix, you're going to say the order alone. Might
Yeah,
be
you can say 1,
yeah,
for
yeah, yeah.
example, B, 2,
Mm.
C, 3,
Yes,
D,
yes,
4,
yes.
A, no?
Yeah.
So that you
Mm.
can even put in the chat,
Yes, put it
right?
in the chat box. Yes, yes.
Or no, maybe if you raise your hands, you can even talk.
Sure, sure.
Yeah.
Jay,
No, no. If
just
you
let
just
me.
put 4, 2, 3, 1, it does it. We don't know. Oh, you're prioritizing it. Okay, fine.
Yeah.
Okay. So it'll be. So we have to take
This
it
is,
that the
yeah.
first one is 1 and 2, 3, 4. Yeah, that's smart. Okay. Yeah, that's better.
Okay.
What Abdul Jilani has done is much better. Okay,
Yes.
so it is much clearer.
Yeah. Even the alphabets in the order is also fine,
Yeah,
doctor.
alphabet in order is
Yeah.
fine. Yeah.
Yeah. Yeah. So Rima D'Souza, Sanjay Kumar, I'm putting like T B C A B D C A. This is also fine. Good. Remember all your no Eisenhower matrix selection, because in the next slide, no, we'll be showing you like whether you're right or wrong. Raised her hand. Do you want something to be asked?
Yeah,
Do you
you
want
can.
to? Yeah. Jay, can you give the access for her to,
Yeah, you can unmute yourself and talk.
Yes. Yes, Pungudi. Maybe it is accidental hand
Yeah.
raise. Might be. Okay. I think now, for now, you can remove the access, Jay. Yeah. Thank you so much. So I
Thank
think
you
we
for so
can,
many people,
yes, yes,
responding to this. Yeah, let's see the answers.
yes. So most of the answer which I have seen for is a DBCA. Okay. So
DBCA. Yeah.
yes, DBCA. Okay. Okay. The first thing is about, malfunction of the equipment, which is affecting most of the patient care area. So
So that
that
is
is very,
D, right? D.
yes, D, D.
Yeah.
So D, scenario D is in the first place, which is urgent, and it is important. Okay. And quadrant 2, not urgent and important. What you have put forth here is like, I think, option C. I'm very poor at remembering, doctor. I'm just going back. Okay, this is about administrative meeting policy. It is
About
about the
policy
policy
update.
update. Yeah, it is about the policy update. So it's in the
That is
quadrant 2.
C.
C, yes.
Yeah.
So D, C, and third quadrant, we have the printer is not working at the nurse's station. So that is actually, I think we have given in the B. So scenario B. So that is not important, but it is urgent. And quadrant 4, it's about, organizing the personal supply and arranging the workspace. It's about A. I think D, C, B, and A. Am I right, doctor?
Yeah, yeah.
Yeah.
So I don't think anybody has doubts about D. I think most of the participants had D. It is only in quadrant 2 again, some confusion is there.
Yes, yes.
So as I told you, the important, not urgent. The question to ask is, will this, it's not urgent, but will it affect the patient care or my professional development? Then it becomes important. Is it important to patient care? Not now, because it's not urgent, but in the future. Or is it important to my professional development? Not now, but in the future. So that is why, the policy updates are important, but not urgent.
Yeah.
And
So
then,
most of them yeah, I'm sorry, doctor, I'm sorry.
yeah, go ahead.
Yeah, most of them I've got that quadrant 1 and 4 in the right place. Only they are confused between this quadrant 2
Yeah,
and 3. So I think you can give the explanation for them, why the policy we have taken in the quadrant 2 and
correct.
the
So
printer.
policy
Yeah.
updates is, no, as I said, it's important, isn't it? But it's not
Yes.
urgent. Okay, so you don't need to have the meeting today, but you will have to plan it and do it at a time when everybody is available. And the third quadrant, not important and urgent, is the printer malfunction. Okay, so printer malfunction is not very important in terms of patient care and things like that. But if you don't repair it, you can't print the discharge summaries, right? And
Yes.
the whole cascade of events will happen. No insurance, things, and everything will sort of pile up. So it is urgent.
Yes.
So you need to fix that. Okay, so that is no not important and urgent. So purely looking at a printer malfunction, no, you won't say it is important. No, that's why it's not important. But in terms of the context in the healthcare, no, it becomes urgent. Whereas if it is probably an office where only three people work and very little printing activities is going on, then it won't come under quadrant 3. It will be not important and not urgent. You'll get pushed to quadrant 4. So you understand it changes based on the context. Here we're talking the healthcare context. And quadrant
Yes.
4 is rearranging your workspace and rearranging the files. This is a busy activity, but not important, not urgent. So I hope that's clear.
Yes. I think all the participants would have got the clear idea now, like what has to be put in all the quadrants, especially in quadrant 2 and quadrant 3. So, thank you so much to you all. And, next it will be about like how to manage the interruptions, where you were all, at the beginning of the webinar, you were all talking about like managing interruptions in the healthcare is the pain point. So, doctor, can you please take us through this?
You want me to take? You're doing this, no? Sure.
Yeah. I'm sorry. So I can.
I thought
I
you're
can.
trying to interrupt me.
Okay, I'm sorry. It's a good example actually. I've interrupted the flow. So the interruptions, like, no, it affects the like efficiency. It's like, no, most of the recent research studies have been, for example, I have taken the things from I have put only two reference here, that a lot of the research study which has been done in the healthcare, how actually the healthcare professionals are got interrupted during the work. It is very amazing to go through that. So how it was like, 23 minutes it takes for the individual to refocus after the interruption. For example, I'm doing some work, somebody have interrupted and asked a question. To refocus on the work what I was actually doing, it takes almost 23 minutes to get that refocus into that particular task. So that is where, it's a really a pain point when someone interrupts. Now you all will be getting to understand like how far we are struggling to focus into back, and then each.
Sorry, Stella, sorry to interrupt you.
Yeah.
No, I think some people are raising their hands. I feel it is better not to interrupt Stella.
Yes.
Let her let her finish this, and then there will be enough time for question and answers. Thank you.
Yes. Thank you, doctor. I don't take 23 minutes now. So, see, really, like when you're very focused into your work in the healthcare, when it comes to, we are talking about like the major population is about. So, it takes 23 minutes to refocus into that important task what you are actually doing it. And, they have also done a research study how many times that healthcare individual is interrupted during a shift. Very shocking. Every 6 minutes once the healthcare professional is facing that interruptions every 6 minutes once. Now, no, like from tomorrow, you all can see every 6 minutes once somebody will be asking you a question. Either it might be attender or the family member call bell, and like your colleague, calling you up and asking some doubt, or your junior most is disturbing you. It's not a kind of disturb, it's like you're doing some work, and every time they call you up, it's like every 6 minutes once. That's the research actually saying it about. And if you really work on the how to, like, strategically how to work on that interruptions part, like you can save 2+ hours in your shift timing. Like, now we are not focusing on to that strategic management, we are extending our duty and completing our work. If we really work on that structured things what Dr. Pari was saying about, no, so then you can save 2+ hours during your shift time. So this is about like how to interrupt, like, sorry, how the interruptions can be managed efficiently. And you have a very good shield assessment here. So 5-second decision, somebody is like going to interrupt you, somebody is interrupted you already, so now you're going to use this shield to question yourself, what is it about. We'll look in depth in the future slides. Just giving you introduction about that is about looking about the safety aspect. Is that like somebody is interrupting you, you have to think about, like, is this about immediate patient safety. And second thing, you have to think about whether it involves any health impact, like will delaying this interruption, like some questions which has been put forth to you, like will it delay or no harm the patient healthcare outcome. And third thing is about information is critical, like no, is this time sensitive information that affects current care decision. Fourth thing, no, you have to think about whether emergency backup, like am I the only person to address to that concern, so that question should be in your mind. And fourth thing is about learning opportunity, is that the moment we can take it up now and then we can teach our juniors how to manage this well, or no, to enhance the team capability. And fourth thing is about, no, are we going to do that, or we can even delegate to someone who are like no equally expert at it like us. So no, can this wait until my current practice is complete, or you can delegate it. So these are all the 6 important steps. Shield assessment step, which is like it takes 5 seconds to take a decision. No, really that interruption matters a lot, or it can wait. So we can see step by step what we are going to do.
Just go back to the that slide. Just just to
Yes.
emphasize that shield actually stands for the as a mnemonic.
Yes, yes, control. Yeah.
SHIELD. Shield.
Yes.
S for safety, H for health impact, I for information critical, E for emergency backup, L
Yes.
for learning opportunity, D for deliver or delegate. So these are 5 quick questions you have to ask, and you can remember this with the word shield. Shield yourself against interruptions. So
Yes.
that's why we have chosen this. Sorry,
Yes.
again to interrupt you.
No, thank you so much, doctor, for the valid, important points to keep it in your mind. So first we were talking about safety. So this is about like immediate patient safety. For example, I want to give you one example. Imagine you're doing antibiotic no infusion to the patient who's already known case of CLAPSI, like the patient, or to be very simple, patient have some bloodstream infection, and then no, you are in the process of preparing the antibiotics. That is very crucial. No, when preparing medication, you should not be interrupted. So that is important thing. So somebody is like no, your junior most is coming and asking you, can you help me out in putting an NG tube insertion? So now this question comes, is this about immediate patient safety? Like, is it actually no? The NG tube can wait for another 10 minutes. So meanwhile, you can prepare the medication where the patient is like waiting for the the treatment. So you have to focus on your antibiotic preparation process, and you can ask your colleague, no, the junior or the colleague, to wait for another 10 minutes. So it can wait. It is not about the patient safety. So then the next thing is about health impact. Now the same thing, delaying the NG tube, will it harm a patient health outcomes? No. But delaying the antibiotics, which you are actually doing now, the preparation process will obviously affect the health outcome, because patient already got into the infection. You are preparing the treatment for the patient. The antibiotic preparations are going on. That cannot be interrupted. Rather, that interruption which have come from your colleague or a junior about the helping, assisting for the NG-tube insertion can still wait. So this is about health impact, how you have to think about that. So it is about, if it is yes, then you have to address. Here in this no example, it is like no, then you continue with your process. And third thing is about, you have to, third thing is like, information is critical. Is this time sensitive information that affects current care decision? If I am not helping her, for example, might be, now giving another example, your like colleague would have received a phone call on critical lab alerts. So that's where the place, that critical lab alert, immediately it has to be communicated to the doctor to proceed with. Either the patient, like troponin level, about like low troponin level, something the information is about. Your junior is not good at handling in the critical care lab alert. So at that time, you can delegate the task what you're doing to the other colleague, and then take up that information if it's critical. So that's how you have to think, what is that interruption is about. Here the example is about critical lab alert. It's very important. So the work which you are doing, you can delegate it. You cannot wait for another 10 minutes. Might be the other patient is already dying, so you have to take the important decision there. And the other thing is about E in the shield. So it's about emergency backup. Am I the only person who can handle this right now? For example, code blue have arisen in your department when you're doing the same medication preparation process. Imagine the colleague, no, the junior is coming now and interrupting me your work, saying that code blue is announced, like, no, sister, come help for us. Like, you have to think whether only you can handle that situation, or you have another colleague who is expert at expert at handling that emergencies in the ward setup, addressing to the code blue. Or today you're not the person who are addressing to the code blue. You will have a fixed designated healthcare professionals who are handling the code blue. So already in the list, then you have to decide whether you have to go or you have to. If you're not that person who is going to address that, then you can finish your task first and then you can continue it. So L stands for learning opportunity. So same way you're into that process of your task medication preparation. Is this a teaching moment to enhance? Middle of the procedure, you cannot teach something to that junior how to do things. For that, you can allot a time. Like, if time permits, engage briefly. If you're free. If you're doing middle of task, you have to continue that, complete it off, and then allot some timing. Like, I'll come in 10 more minutes and then I'll tell you how it can be done. For example, the same junior who have come like asking doubt, can you assist in rise tube insertion? You can take that opportunity to train that junior to how to do that efficiently, but that can wait for another 10 to 15 minutes, not in middle of your medication preparation process. Then the last one, defer or delegate. It is about, can this wait until my current patient care is complete? So it is like, set specific time to address. For example, if this process can wait for another, you can say, I'll come in another 10 to 15 minutes. And then if it is no, it cannot wait, then re-evaluate if it's truly urgent. It's like nobody is there to take care of that particular procedure. It's very urgent, only you can do that role. Nobody is there like in the duty where you're doing now, no competent as like you to do that. Then you have to show your heads up there, where what is the process you're doing up, and you have to give to the colleague who is like good at it, and you can address to that point. So this is about defer or delegate. So this is all about this shield assessment. Doctor, do you want to add something in this? Doctor?
I was on mute. No, that is a fantastic explanation. I think it was very clear.
Yeah.
So, as we saw, handling interruptions seems to be the major challenge for majority of the participants here. So I hope this shield assessment of an interruption will help you. And this won't take time, actually. You just look at patient safety and healthcare impact. Is it, is it going to do that? And it can actually be answered. Two of them can be answered together, right? The safety and
Yes.
healthcare impact. And
Yes.
the next one is the, what is the next one? Can you just go back? I can't remember this
Yeah,
mnemonic.
sorry.
from the life of me. Um, yeah, now put that slide where it shows the full shield, you know.
Sure, doctor.
So what I wanted to emphasize is that it's not going to take time, okay, in answering this question. Though, no, it takes a lot of time to explain what is shield. If you are going to use it on a regular basis, is it more important than the task I'm doing in terms of safety and health impact? Okay, is it a very information, critical information that I have to drop what I'm doing and then pick up the phone and call? Am I the only one who can do this job or someone else can do it? Okay, and can I delegate? And if somebody is going to come and ask me, how to do it, can I take that 1 minute and take that teaching moment and do it? So even if you leave that, so it's these, three questions. Is it, safety or outcome? Is a critical information? And the next two is about delegation. Am I the only person? If not, delegate. Okay, so you understand. So though we
Yes.
are trying to tell it in five, it only takes you 2 to 3 seconds to decide this. So I hope this helps you in managing your interruptions. Yeah, let's go
Yes.
ahead. Yeah.
Thank you so much, doctor. I really wanted you to emphasize the points again. So then, okay. So next comes, delegation part, which was very important where we spoke in the shield, mnemonic. So, doctor, can you please explain like how to delegate smartly?
Yeah, again, no, it all depends on which level are you in the hierarchy. Only after at least you have one monkey under you, you can delegate. Okay, so if you are the last monkey, sorry, you can't delegate. You are there to do, no, you are the slave and you have to
Yes.
do all the work. So no, you have to wait. Your time will come. But for people who are have people working under them, they can delegate. But most often, delegation does not happen. That's why we have to discuss this, how to delegate and how to delegate with confidence. So several things are important. You should know also choose which is the right task to delegate. Okay, so you need to choose the appropriate task. We'll go a little bit in detail in the next slide. And if you are beginning to delegate to a person who's just under your supervision, start with non-critical jobs and see how well they do it. So that's very, very important. Then choose the right person. So, okay, so you need to make sure that that person is trained, that person is available at that time, and confident of doing the job on their own. And then give clear instructions when, no, what, how, and what after they do it, what is the expected outcome, and follow up and provide feedback. Okay, verify, support, and so in the beginning you need to actually micromanage. Now people say don't micromanage, but in the first step of delegation is micromanaging, where you tell them, yeah, do this, and then watch them, and if they miss any step, you teach them. Okay, so if you do that, then you can actually delegate with confidence. That you've chosen the right task for the right person, given them the clear instructions, and also you have in the past supervised them and made sure that they are able to do the task well, then you can delegate with confidence. So let's look at a couple more slides to explain this more
Yes.
in detail. So the five rights, no, for the right side, five rights of medication, we have the five rights of delegation. So no, I feel like T. Rajendran. No, he has got this uh, where you'll say delegation is the medication of the something like that. So twisting my tongue on delegation. So as I told you, the right task is very important for that person is very, very important. The second is the right person. Okay, so is that person qualified and prepared to do? So this is where privileging is very important. You can actually systematize this, instead of doing it on a case-to-case basis. So you can actually systematize this by training your juniors and also privileging them what to do. Now we run a DNB course in our institution, and we have various privileges for the first years, second years, and third year PGs. And also within the first year, we have the first 3 months, the next 3 months, the last 6 to 9 months, and the last 12 months, because they keep on increasing. So in the initial phases, the delegation will be very, very minimal. Okay, it'll be mostly supervised, and it'll be no mostly supervised by the senior person. And then gradually, when they go to the second year, the supervision is only by the senior PG. So even that, the delegation of the supervision also can take place, no, if you do it properly. So the right person, you need to be privileged. So the next R is the right circumstance. Okay, so if you are now going to delegate in a very stressful environment, where into a person who is not yet confident about the job, then it's going to be a problem. Okay, so you need to make sure that you choose the right environment and circumstances when you delegate. Sometimes it may be better that if you do it, it might be better. Then the fourth one is the right direction, meaning the communication. You have to give the right directions and make sure it is very, very clear what you are trying to say. So again, this SOPs and all that help. Training helps in this fourth R of delegation. And the fifth right is the right supervision. Okay, as I told you, you have to supervise in the beginning, and later you can actually delegate the supervision also to your senior most person in the department, if you have actually trained them to supervise the delegation. So if you choose these five rights of delegation, then again, it'll be very error free, or less error prone. Next slide. Okay, I'm just going to add a few time-tested tips and hacks, which no, we actually tell other staff in our hospital. So next slide. So one is, in a busy shift, as I told you, the quadrant 2 tasks are the important and not urgent tasks, and they usually get pushed in a busy shift. And if you don't keep doing it, then it adds up. Typical NABH assessment is a very typical example, where if you don't do your NABH tasks and keep on postponing it, the assessment will come within and in the last 1 week you're running around. So in every shift, you have to block 10 to 15 minutes of time, and you know which part of the shift actually is less stressful, less busy. So choose that time to block and do your quadrant 2 activities. This helps you in the long term. Okay. Then you need to schedule routine activities during predictable low activity periods. This I already explained to you just now. Okay. So these are where you can be sure that you're not interrupted. That is the reason. And then if somebody comes and says, or the patient and family want to discuss with you about the patient, or you need to give patient education, then you can actually, in the shift, block a time saying, this is the time I will actually counsel. So many intensivists do that. Okay, the intensive care consultants actually have a time where they will block and go through all the family interviews with that. So that is a very, very efficient way of using your shift time. And again, prioritizing, use the Eisenhower matrix. So next slide, please. So the next is, now you can use some frameworks and tools. So we have SkillsFormat has got the great method of communicating with patients and family. If you're not come across, you can attend our communication workshop, or even sign up to our communication course online. So this will help you to communicate to the family very efficiently, instead of just doing it unstructured. And then in an emergency, as you know, the ABCD assessment helps you to save time and to be efficient. Similarly, in communication, the SBA. So like this, there are several tools. Even today, we have mentioned about Shield and things like that for your interruptions. So use these tools and frameworks to save your time. I think that's it. There's one more. I think it's about digital tools. I think next one, please.
Yes, doctor.
Yeah. So, the era of digital tools is come. I mean, already it's come. AI is already come. So we all need to be digitally literate. Many hospitals have EMR systems, alerts, and things like that, which you can use. There are several mobile apps which will help you to take notes, have your tasks listed. You can use that. Communication platforms like internal communication platforms also saves time, and make use of your automated alerts to notify, like SMS messages, WhatsApp messages. All this can be used. So all this helps, but be careful, because many times these digital allies will become your enemies. Okay, so they'll be between your patient and yourself. So you have to be careful and use the appropriate tool in the appropriate time. So I think that's all I wanted to say about delegation and these tips and tricks. Over to you,
Yes.
Stella. Yeah.
Yes, thank you so much, doctor. I think they will use all the delegation strategies in their, from tomorrow onwards. So coming back to the webinar hero, so you met him in the beginning of the webinar, no, Arjun. So started the busy shift. This was his busy shift. You all remember, no? 6:45 started com, 7:15 about like critical events, and 8 a.m. already like behind his schedule. So after no knowing this Eisenhower matrix, so he was able to sort out and put out all his actions. For example, if you could see like urgent and important antibiotic medications, immediate pre-op, and critical lab. This is just an example to show you like how you have prioritized things. And also Mr. Arjun equally, quadrant 2, he have identified about the patient education, discharge planning, and fall risk assessments. That can be like he can allot time for those actions. And coming to the quadrant 3, it's about like urgent, which is not important but still you have to do it. It is like form that could be completed later without impact on care. And the fourth quadrant, he had put information sharing and then overwriting routine notes. He's gonna to minimize those activities, so that is why he have put forth in the quadrant 4. So that's good. Now Arjun is able to prioritize his action, and now he have become calm. See how it looks like mid shift chaos, all these critical events coming in between, the way when he is working in his routine thing. So emergency department consultation have come, he responds immediately. And supply ordering request have come to him again, so that is actually interruption. So how he is going to do, he is going to redirect. It is about like delegating to someone who can do that. So because he is at the emergency department consultation. And admin progress report he is going to put into the quadrant 2, where he will schedule the timing for that. So as a result, he maintained focus and while addressing the real priorities. Now you can see Arjun is like very happy as the successful shift completion. So all quadrant 1 and 2 priorities completed effectively based on the Eisenhower matrix, and team coordination is improved through systematic approach. Dr. Pari have said a lot of things about that. And professional communication maintained under pressure, like when he so much pressure, he like what kind of framework or tool. For example, we were talking about the greet, the framework which is like given by the skills format. So and then a lot of frameworks, like we have ISBAR to communicate with the healthcare professionals. All those things can help him during the pressure situation. And Arjun feels accomplished and ready for tomorrow's challenge, because he already know how to manage the emergency situations and how to prioritize his tasks. So why not, he is like ready already for all the tasks to be carried out. So the prioritization, coming to the summary part, we were looking up on Eisenhower matrix, and then categorizing the task, how to do it, and how it is like you're going to look about the urgency and the importance. And we were looking about the healthcare framework. It's about GREET, ABCD, ISBAR, and 2-minute rule. And do it now if it take less than 2 minutes. If it's more than, then doctor was saying about the checklist. And interruption triage, stop, assess, respond, and redirect. And finally about the smart delegation, where it is about right task, right person, right time. We had 5 things: right circumstance and under right supervision. And implement these strategies to transform your healthcare practice. And Thank you all. So the same, our hero is saying thank you. So we are open for Q&A. I think we have run a bit, 15 minutes. We have taken extra from your timing. Thank you all. Everybody is like still in the forum. So excited to see you all till now. So we can open up for Q&A. Before that, I have one small announcement. It's about, we have planned to give away the resources after the webinar, because we were giving the certificates for you all depending like based on the demand from various nurses from various places. No, why can't you share some resources for us? So taking up that as a note, what we have decided is like we have the website where after 2 or 3 days after this completion of this webinar, we have decided to put the resources in that site. So resources are at the limited cost. It's just going to be cost for 99 rupees from each of your pocket. It's not too much, but the resources what you're going to purchase from our side is like it's going to be a valid resource where you can use for your education purpose, for the display purpose, or to train someone, or for the to share with your colleagues. So it's going to help in all various aspects. So make use of that. We are going to start from this webinar onwards. So about that detail things about like how to reach out the website, how to get the resources, you will get all the informations in your mail. As usual, post webinar you will be receiving the mail for the certificate. In the same mail will drop down all the informations. Thank you so much. Thank you all. We are open for the Q&A, and meanwhile the Q&A session is going on. In the chat box, the feedback link have been put by our admin manager. You can click that link and then fill the form to get the certificate as a part of participation to this webinar. Thank you all. We are open for you all your questions. Yeah. So I'm taking up the Q&A.
Yeah.
Yeah. So one was like, kindly I need more information about communication online program. Yes, Navroz, you can, if you really want some more information, we can reach out to you. You can reach out to our admin manager. Am I right, sir?
Yeah. The online communication course is available in our
Yeah.
website.
Yes.
The
If you
next,
have,
the next communication webinar we will announce in due course. Yeah.
yes. If you're Navruz Othman, if you're talking about like communication online program, you can reach out to our website. If you have any difficulty, you can contact our admin manager. She will help you out to enroll into that program. Thank you so much. And from Nushin Hamad, in a shift as a nurse, bedside patient care, we have daily and monthly
Beside
assignments.
patient care. Yeah.
Oh, beside patient care, I'm sorry. Nurse, beside patient care, we have daily and monthly assignment, how to do and when to do. Is it really job of nurse to check like consumables, counting, narcotics check? So these are the
Yeah, I think
work
the
which
second
comes away.
question is not for us to answer.
Okay.
Yeah, if we see the daily and monthly assignments and all this stuff are routine work, right? So which quadrant will it go to? So is it's important but not urgent, right? So
Yes.
it all depends on your point of view. If your last half of the question you having no, you think it is not your job, then it will go into quadrant three. Okay, it is no, it is not important but urgent because somebody is forcing you to do that. So as I
Yes.
told you, in healthcare especially, the hierarchy is very important. You should know where you are in the hierarchy. When to say that I won't do it or I will do it. So if it is your hospital policy and you are the person responsible to do it, you have to do it. And you have to find time, as I told you, in the less busy times of your shift. All shifts are not busy the full 8 hours or full 12 hours. There are several gaps where you have some time. That's when you have to schedule it.
Yes. Thank you so much, doctor. And that's all the question.
I
I think
think
one
in the
more question
comments,
came up.
there are some question.
Yeah.
Um,
So,
I think there's one. I think Kulandai Teresa. Is it Kulandai? I don't know what the name is.
yeah, Kulandi
Um,
Teresa.
yeah,
So nursing
nursing
supervisor.
super. Is it an interruption?
Any ideas for the
Interruption
rounds
to
to be
whom? I
fruitful?
don't know.
Yes.
I'm sorry, and sorry, Teresa. I didn't want. It's not that I'm trying to ridicule or anything, because I really respect the nursing supervisors. It is not an interruption, to be really fair. And how could it be fruitful? I think that's a separate topic by itself. So I cannot explain that. Just give you a few pointers. So basically, you need to decide what your role is in terms of supervision. Again, it depends on the hospital policy. Okay. So if you are in charge of a particular area of the hospital, and if it involving only one specialty or multiple specialties, these are all so many variables. No, nursing supervisor job is not homogeneous. It varies from hospital to hospital. But basically, you should understand what is your job responsibility and what is your no what is that you're trying to. The outcome is very important. Because of the supervision, what are you going to achieve? Many times I feel, I'm really, appreciate you being frank. I don't know whether you're a nursing supervisor or not. I really appreciate that you said, is it an interruption? It is an interruption if you are aimless and you have no planning without looking at what is the outcome of your supervision. Then your juniors will think it is an interruption. Whereas if you have planned it and you have looked at what is going to be the outcome of my supervision, then I think it becomes very, very valuable. So it all depends on where you're coming from. I did laugh because I have this. I also written a blog on this. I call this old bandicoot syndrome, right? So these are senior nurses who have grown with the institution before NABH and before everything, what they say is the right thing, this sort of attitude they have. And then the systems, you're trying to put in systems and you're doing the training. And these, seniors, it becomes a threat to them. So they will not allow change to happen. They will try and, put barriers to the change. So that is when the nursing supervisors, supervision becomes interruption. Whereas if they are aligned to the change and if they want to be a part of the change, then definitely it is a very, very valuable exercise. I'm sorry it took a long time, but it's a very important aspect to discuss. Thank you
Yes,
for asking
yes,
the question. Yeah.
yes. Well addressed, doctor. And I think one more question was there in the Q&A. Just they have posted it. It is about how can we prevent the interruptions during medication administration. I think we have discussed this,
I
in the
think that was in
CNA.
the online scene. Yeah.
Yes,
That,
yes.
yeah, you can share that, Stella, in a few ideas.
Yeah, so what we have discussed, no, during the medication administration process, I think the question from Lakshmi D. Murugan, thank you for highlighting this. This is the pain point for all the nurses when they are preparing the medication. So how to, stop that interruptions? You can have a red zone area in your unit. You have the medication preparation room. You can have the red zone. When you are inside that, nobody should, disturb you. Or even you can wear, over jacket where it would be like no like you are like preparing the medication, do not disturb, no, like that you can tagline, no, and then you can wear that no off coat type, and then you can, when you're doing in the process for that, initially you have to fix up your SOP and standardize this among all your nursing units. When this particular things are happening, like nobody will come and interrupt you. When it get disciplined, then no, during medication preparation process, nobody will distract you, including the doctors. Everybody should know the update, like what you're doing in the hospital. So when a particular nurse is wearing that overcoat with do not disturb, then it means she is involved in medication administration process, and in the red tag area wherein like you are preparing the medication. So that is what, doctor, do you want to add something else with this?
Yeah, yeah. I mean, these are very simple, hacks, I think. So putting
Yes.
that red line is like Lakshman Rekha, right?
Yeah,
So
yeah. I
once
didn't
any,
got that point. Yeah, that's why I just asked you.
so
Yeah.
once you step into that red line, nobody should disturb. And as Stella pointed out, SOPs, training, education should be in place before you do that. Otherwise, people won't understand.
Yes.
And wearing the vest, like, the hazard vest which the policemen wear, with the do not disturb vest, also very, very efficient. But it is like gloves. You have to remove it when you're not, in that area. Now people keep using wearing the gloves and touching the handle and all that. No, similarly, if you keep on wearing the vest wherever you go, then you don't be respected. So when
Yes.
you wear the vest, and you don't want to be disturbed, then people will respect you. Very, very simple innovations. Please try that.
Yes. Yes. I think we are over with all questions, Doctor.
Sure. So I,
Yeah.
I can leave now.
Yes, yes, you can leave now. I'll leave announcement for the upcoming webinar and then no, like we'll wait for the others to fill up the feedback forms. So upcoming webinar on August 15th, we don't have webinar because that is like Independence Day. Like everybody will have the holiday in many of the places. So the upcoming webinar will be happening on August 22. So the topic will be theme focusing on learning from errors and incident report, and topic like it's about what if no the turning schedule is not maintained properly, what happens to the particularly we have taken one disease condition, it's about the hemiplegia patient. So this is going to be quite interesting for the all the healthcare professionals who are in the critical care area, even in the ward setup. So next August 29 would be the inspiration in science for nursing leaders. Wait for the other week. So we'll be announcing you. We have a great leader for this program. So we'll be announcing that. So thank you all. And then like in the chat box, every 5 minutes once, our admin manager is putting forth the feedback link. You can fill that form and then you can leave the Zoom room so that we'll have an understanding. So only the pending participants in the Zoom room are yet to fill the form. Thank you so much. Thank you, Doctor. Sir is there? And like participants in the YouTube, even you have put in the YouTube, no? Even in the YouTube chat box, we have put the feedback link for your easy access. So participants who have joined in the YouTube can fill that form, no, and then get the benefit of the participation certificate. Thank you so much. Thank you all.